One of the most important things you can do if you have some SI joint dysfunction is stabilize the area around the SI joint, specifically the glute max. To do that, we're going to take bridge pose. We're not going to take bridge pose though in the way that we normally do when the hips lift all the way up. Instead, you're going to lift your hips just about 2 inches. You can see that the space between my buttocks and the floor is really just around that much. Now, from here, I'm going to shift the weight so there's about 70% of weight into my right foot. That's the affected side, it's the right SI joint. 70% of weight in the right foot. Pelvis stays neutral. And now I'm going to grip the glute. So right now I'm sending neurological signals to the glute max to be engaged and to be strong. And then the final action is I'm going to put a slight little tuck, posterior tuck of my pelvis, so my pelvis moves this way. You can see that right here. You see how it moved from here. Now I'm getting full activation of the glute without any compression of the SI joint or of the low back. I'm going to stay here for 20, 30, 40 seconds. Come down, and then you'll repeat. Do that a couple times on the affected side. That will start to get some stability for that SI joint. If you have some SI problems, it's really important that you strengthen your abdominals, specifically the transversus abdominis, that deeper abdominal muscle. To do that, dead bugs are really one of the best ways. So you're going to lie on your back and put your hands on the wall just like so. Legs are going to come up to around 90 degrees, and you're going to press into the wall with your hands. Just that action of pressing gets the abdominals to engage. And then you lower one leg, and then the other, one leg, and then the other. Do that a couple times, do that for 30, 40, 50 seconds. And if you want to progress it and make it a little bit of a stronger action, your legs come up, your arms are no longer touching the wall, hands come up to the ceiling, and then your left leg and right arm are going to go over the head while your left hand and right knee touch each other, and then you'll switch. Now the nice thing about this is when you touch your right hand against your left knee, it's an isometric contraction of the abdominals, so you're just going to hold and press and get everything here to engage. Hold and press. Hold and press. Hold and press. That's a dead bug for helping the transversus abdominis and rectus abdominis engage. In addition to strengthening the glutes and strengthening the abdominals, we really want the entire back line of the body to stabilize around the SI joint. For that, we're going to play with a pose called locust pose. You lay on your stomach, forehead on the ground, arms by your sides. Lift the arms, lift the legs. You can hold this for an extended period of time if that feels good to you and it feels like it's stabilizing, or you can do repetitions. If there's any pain at all, don't do it. That's a compression of the SI joint. You don't want to continue with that. But if there isn't pain, you're strengthening the area. In addition to doing this, we're also going to do a different variation that strengthens the glute. So you're going to lie on your stomach like so. Leg is going to come up into the air. Again, if there's pain, avoid it, or hopefully there isn't. And then you're going to take your leg out to the side and back as much as you can. The moment that you start to take this leg out to the side, it gets all of the fibers of the glute max and then the glute medius and glute minimus, so some of the other glute muscles to engage. And you'll do that a couple times. Again, only take your leg so far that there's no compression in the SI joint. If there is any compression, back off. See if you can still do it, but to the point where it feels like it's a strengthening exercise rather than a compressive force. We also, of course, need to strengthen the oblique muscles. There's really a lot of exercises to strengthen the obliques, but the side plank with the knees bent is a really nice one. So right here, as I lift up, all these obliques on this right side of mine are being engaged. You're going to hold this, and then you're going to just play with a couple leg lifts right here. Again, only if it feels pain-free. We're looking to strengthen and stabilize everything around this core region. Okay, do a couple of those, 30, 40 seconds, do each side, see how that works. And of course, one of my favorite things to do whenever I have pain anywhere in my body is to take a lacrosse ball and just roll that area out. That rolling can release some of the intensity of the sensation, it can release some of the tissue, it can provide a lot of relief. So, I personally like a lacrosse ball. You can use a tennis ball, but I like something a little bit more firm. The SI joint, you know, is right around here where the ilium and the sacrum articulate. So you're going to take the ball, you're going to put it directly onto that SI joint, and just start to roll around a little bit. You might find that maybe above the SI joint, somewhere in the lumbar spine is where you need some release. Go for it. You might feel like you want to roll out the hip a little bit, right around the greater trochanter, the hip bone. Roll that out a little bit. But also see if you can find that SI. You can bring the knee to the chest. You're just going to roll, move. Listen to your body. You can stay in a place for as long as you need to. You can roll around for as much, but try to find the places that are creating some aggravation and then give them as much relief as you can by using the ball. Okay? See you.